Thank you. Sorry for that, sir.
Dr. Ashish, again, I think something which is very, very important for us, and as already mentioned by Ashish and Nilesh, I think somehow as far as biosimilars in ophthalmology are concerned, India is a leader. So that's a great thing for us, and these are my financial disclosure. I think already these things have been talked, that these are mostly the three molecules which we have, Razumab being the first one right from 2015, and then came the Lenalidomide and Ranibizumab. So, and we going to have aflibercept biosimilars. I think they'll finish, they're already on trial, but they can't have it before 25, 26, so we're going to have more of them. So that is what is going to happen. I think this also again already emphasized and talked by Ashish about the trial, the limited numbers as well as the period for which we study. But that is the way it is, and maybe that's how perhaps in the beginning we did have some safety issues, and so I think we have to learn that. I think what my interest here with you is to present some real world data, especially of course there's a, you're going to have a lot of that from Dr. Devulal also here. And I think once we look at the Razumab, Intas, this biosimilar, this has been there almost now I would say 9-10 years. And the Reliance of course came in 2020. And the Lupin one, Renai, is in 2021. And of course, all of them, they have some kind of a real world data, but limited. But I think most of the work here again has been done by Dr. Ashish and his team. And I think this is a dated data. Now the total number of injections have gone up. And I think so is for Razumab. I think the numbers have gone up. And I think I must mention here, I think Manish is here. I think I used to be heading the retina in PGI Chandigarh as well as retired from there. I wouldn't let it in. We didn't let it in because it would develop problem, safety issue. And it started much later. Can you imagine 15 it was introduced and it ultimately started somewhere in 20. And where I work, I'll show you, it started in 2021. And that was the takeoff point, because before that, I think safety issues are, that's how you have to build a confidence. I keep getting all these rainy eyes, right? They have to build our confidence. I tell them that show me that somebody has really had, I'm not concerned. They are all efficacious probably. The safety issue should not be coming. I think that is what the point was very well taken up by Dr. Ashish. I think this survey is very important by the Vitreoretinal Society of India. So most of the people are familiar with, and there was a progressive trend favoring use of, you see, we only have Ranibizumab biosimilar over Biosimilars, and need for enhanced, you see, that is what, and larger trials as well as, of course, more stringent regulatory control. Somehow, I think the pricing and other things in financial aspects is also being talked by Dr. Tiwari subsequently here. What I want to share here is, this is one young, now I have retired from the institution where I was. So you can see now, most of the anti-VEGFs in a month, they are Razumab. And this is my center, which took only in October 21, where I work now after retirement. You can see now the Razumab has become a leader. So that's where it is gone. And this is just, I'm showing how efficacious it is. No problem. More patients are coming in, more patients are enrolled, and we have a very good efficacy. I think in summary, I would say from a slower adoption to a market leader. That is the way it is. Because I already talked about slow adoption, how we adopted slowly. But now, at least I can say we have so much confidence on this molecule that we are using it for ROP. You know, this is approved for ROP. And under that Janani Suraksha Yojana, that subject has been the most close to my heart all my life. It is provided free by the government. And it is being used. I have told most of them to generate their own data and come out, and so that we have more confidence, and we can definitely say that this is something which can be very, very safely used. And of course, I think we have more and more patients now being treated. They can afford our treatment, and because it requires multiple injections, and that is what is happening with all the biosimilars. So I think it's an exciting time as far as biosimilars in India are concerned. Thank you very much.
Thank you so much, Dr. Mangat, for